I'm Arti Shah. I'm a consultant radiologist at Hampshire Hospitals NHS Trust. I'm really passionate about MR and I tend to report quite a lot of pelvic MR and body MR, and prostate MR is a real interest of mine. It's a really exciting time to be a radiologist that's interested in prostate MR, because even in the time that I've been a consultant, I've seen a complete sort of sea change in how we approach management of prostate MR, prostate cancer, with MR moving to the very front of the pathway and becoming such a crucial part of the patient's journey through their diagnostic pathway. The reason that we were so excited at HHFT, which is our hospital, to sponsor this study is because we realized that we are going to be doing a lot more prostate MR. If I look at how much prostate MR we do today compared to even 2 years ago, the volume has almost doubled of work. And sadly, the number of us that report these has not doubled or trebled. So anything that we can have that makes that process more effective, more efficient, more streamlined is really welcome. And I think that as radiologists who are experienced in doing prostate MR, we can only be excited about something that comes along and hopes to make that process much more economical in terms of our time, and also produce a report at the end that the urologist will find much more useful. So I'm really excited about this study from those points of view. As you know, the goal of a good MR report, and I feel this really strongly, is to direct your urologist toward a clinically significant cancer, reduce the amount of unnecessary biopsies that you do, and also increase the amount of clinically significant cancers that you're going to pick up. So in my mind, this software has the ability to help all of us do that a lot better. And one of the really unique things about this study is that it's going about doing that with lots of different vendors of MRI and lots of different field strengths of magnets. And if we can show that this software is going to work for people like me working in a district general hospital as a radiologist, having to report large volumes of MRI, then that's something that is so exciting in terms of sort of for me as a radiologist in my career in the next sort of 5 to 10 years. So what we're seeing now is that we have a lot of, because of the success of prostate MRI, we're seeing a lot of patients who have avoided an initial biopsy. And now we have a large number of patients who are on the prostate pathway that are having sequential scans every year on an active surveillance pathway, for example. So as a radiologist, I get to reporting one of these MRIs, open it up, and there will be say 3 to 4 previous MRIs available for me to look at, and I'd have to go through each one of them to see how 1 or 2 possible lesions might be evolving over time. Again, something that can make that assessment more effective and quicker is very, very welcome, because it will hopefully bring and highlight the areas that I should be focusing my attention on and help me do my job better and quicker. Our goal, as with many other sort of hospitals in the UK, is to move towards a rapid protocol type scenario where a patient comes in and is seen by the clinician on the same day that they have had their MRI. This will only be possible if a tool such as Pi, the software that uses AI for interpretation of prostate MRI, will make this much easier by helping us to analyze the prostate MR as soon as it is done, with a report available for the urologist to review on the day that the patient is with him. So the goal of a good MRI report, in my opinion, is something that the urologists can open, that will ideally have bookmarked areas of interest for the urologist. And if there is a biopsy that will follow that MRI, then my job as a radiologist is to highlight the lesions that the urologist will be targeting as part of his biopsy. Increasingly, we're moving to using the MRI in a more sophisticated way so that men with prostate cancer can avoid having huge numbers of biopsies, and you can really target the lesion that you're interested in. So we work really closely, and I'm really fortunate to be part of a really good, excellent center for diagnostic and treatment of prostate cancer. And I work very closely with the urologists to deliver a good report that they can then use for their biopsy. So I know that Richard Hindley, who's the urologist that I work closely with, is really grateful for a good report that will help him to target lesions on the biopsy. And I know that they are now moving to using something called fusion biopsy, which is where you can actually use the MRI images, feed them into the ultrasound machine that you're using to do the biopsy, and that will help you when you use the ultrasound to target a specific lesion. And that relies totally on being able to interpret the MRI well. I'll hand over to Richard now, and he can tell you a little bit about what the process of biopsy involves and how the pathway goes on from here.
So it's very exciting to be involved with the artificial intelligence study, looking at, optimizing and standardizing reporting of prostate MRI. There is little doubt that, as a clinical urologist, the role of MRI is evolving, and it's becoming more and more useful when we are wanting to identify where a lesion is or lesions are within the prostate gland and to target them. We increasingly use fusion software to help us with our targeted biopsies. And if we had algorithms that interpreted the MR, took the time pressure off the radiologist, we could potentially move towards a situation where, rather like with the RAPID study, we could see a patient, after their MRI, and those that required a biopsy, we'd very quickly have a report that could be, signed off by a radiologist, but without the normal sort of time that's taken to interpret the scans and come up with, a plan, a report and a plan for biopsy. The other thing is that having a very detailed, annotated report with visual aids as to where any lesions are within the prostate gland is also very useful. And so, I think anything that improves the efficiency of reporting, standardizes the quality of reporting, has potentially got to be a good thing. And radiological reporting is very time consuming. So I think it may actually improve the efficiency of our reporting. And as we move towards a one-stop arrangement, that increasingly becomes a more realistic proposition to get a significant number of men seen and sorted every week. So yeah, just to summarize again, a high quality, annotated, clearly written report is extremely valuable for any urologist involved with targeted prostate biopsy and potentially with focal therapy. And it may well be that in the not too distant future, artificial intelligence makes the job of the radiologist easier and the job of the urologist, and improves the efficiency of a service when with greater and rising demand on patients needing MR. Then this could be a very helpful development, certainly. Yeah, I mean, it would be great if a patient could have an MRI and then very rapidly, within an hour, let's say, of their scan, I've got a roadmap of where there are any areas of concern, and I can then, for my fusion biopsies, marry those MRI images with the ultrasound images I have in real time when I'm doing those biopsies. So that, anything that improves efficiency there, I think has to be a positive thing. I think the NHS is in a real crisis in terms of the number of radiologists. And so, there's a real shortage. And if these algorithms can help speed up efficiency and get a greater number of patients through their MRI and reported in a shorter time, then that has to be potentially a very, very good thing. I mean, it'd be fantastic for a patient to come and see me in clinic and then go and have an MRI and then come back with a biopsy plan. I think we as urologists, we don't realize how much time is taken for a radiologist to spend looking at each scan, and anything that helps them with that has got to be a good thing, and I guess it will standardize the the quality of reporting.